A lot to get through. It's an exciting session today as we are going over some of the real-time updates with the FreeStyle Libre 2 system, a system that many of us are aware of, very popular with our patients, but there have been updates recently, which we'll go over today. So for the agenda today, we'll do a quick introduction and go over our learning objectives. We'll go into continuous glucose monitoring. We'll then review some of the key updates with the FreeStyle Libre 2 system. And then the apps and softwares that are available within the FreeStyle Libre 2 ecosystem that you can use to help monitor your patients. We'll go into workflow and optimizing patient care, as well as coverage and next steps. As a quick introduction, my name is Molly. I'm a pharmacist and director of pharmacy innovation and professional affairs at Whole Health Pharmacy Partners. I'm joined by my colleague, James Morrison, who's director of pharmacy excellence at Whole Health, and our excellent pharmacy student, Sydney Inman from USAS. She is finishing up her 4th year, and we're pleased to have her join us this evening. For those who are not aware, Whole Health is an independent national pharmacy banner across Canada, and we're very focused on our clinical education as well as operation support. And we like to open our sessions up to our banner and to everyone who like to attend to learn about some of these new products. So for learning objectives today, our presentation is going to have 4 sections. Number 1, we'll review the benefits of continuous glucose monitoring and explaining the difference between time and range versus A1C. We'll also highlight key updates for the FreeStyle Libre 2 system with the new real-time features that I know everyone's excited to learn more about today. We'll then take a look at some of the apps and web platforms that are available to pharmacy teams and to patients to help support diabetes management. And then we'll identify opportunities to incorporate these tools and recommendations within your practice. As a quick disclosure, this webinar was made possible with support from Abbott. So thank you so much, Abbott, and the great team that we work with for supporting pharmacy education today. So let's get into continuous glucose monitoring. I'm sure this is a review for many on the call here, but there are 3 different types of glucose monitoring. We have capillary blood glucose through finger pricking. We also have continuous glucose monitoring through either flash or intermittently scanned CGM and real-time CGM. Now, there is a rule for all 3 of these. For example, finger pricks may be preferred for some patients due to cost or if they only need to test once daily. However, finger pricks ultimately only provide a snapshot and doesn't show the full picture of glucose control within a patient. And then you have continuous glucose monitoring, which is more costly, but can provide a better look at the glucose control for a patient, and it can look at trends. Some patients may or may not prefer the fact that it's wearable, but the main difference between intermittently scanned or flash glucose monitoring and real-time continuous glucose monitoring is the fact that for scanned or flash glucose monitoring, the data isn't automatically captured and recorded. The patient needs to remember to scan at least every 8 hours to capture the data. Whereas with real time, it's automatically captured and collected. So why use CGM? One of the biggest benefits of using CGM is improving patient empowerment in their own self-management. And we have data that shows that leads to better adherence and better health outcomes. So with using CGM, you can get past, present, and a prediction of future blood glucose levels, which then enable patients to make better informed decisions on their lifestyle, on their diet, and on their insulin use. As mentioned as well, there's data to show that using CGM can improve A1C and time and range glucose control. And in addition, there may be several factors that patients enjoy, including convenience and avoiding finger pricks. So we have a quick poll question, and let me put this on time and range. Let me launch this, and we'll give you a little bit to answer. The first question is, what is target time and range? If anyone, we'll go into time and range in the next couple of slides, but if you were to say, what is the target time and range for the average type 1 diabetes and type 2 diabetes adult patient, what would that value be? And the second question, which of the following are true regarding time and range in A1C?
You might need to scroll down to see the second question, folks.
Yes. So answer the first one, and then get to the second one. So the options are a given time and range or a change in time and range could correspond to a wide range of possible A1C values. Option 2, time and range is the percent of time a patient's glucose remains within target range, and A1C is the average blood glucose over a 3-month period. Option 3, higher scanning frequency correlates with higher time and range and lower A1C values. And number 4, all of the above. Okay. I'll just give you a couple more seconds, 10 more seconds, put the answer then, and then we'll go over these in the next couple of slides. Okay, we'll end it there. And so almost everyone, most individuals got the over 70%, which we'll go over for time and range, and that's the target time and range. And for question 2, the true answer is all of the above. So let's go into time and range in A1C. So again, time and range is the, is the percent of time spent in the target range. And for most individuals, the majority of people living with type diabetes, on the leftmost column here, for both type 1 and type 2, spending 70% of the patient's time in a range of 3.9 to 10 millimoles per liter is correlated to an A1C of about 7%, which is where we want our patients to be. And again, time and range complements A1C and is shown to be strongly associated with clinical outcomes and reducing complications. So what is the difference between A1C and time and range? You can see big differences in glucose variability in patients, even with the same A1C. So on this slide here, patients 1 to 4 all have similar A1Cs. So 7.6, 7.7, 7.7, 7.7. But you can see their glucose patterns are quite different and their variability is quite different. With sensing technology, we can better assess glucose variability and time and range. And there's a high correlation again with time and range in A1C, with every 10% increase in time and range correlating to a decrease in A1C of 0.8%. I didn't mention this earlier, but if you have any questions during the session, feel free to put them in the chat in the Q&A, and we can either address them when you bring them up, or we can address them at the end. So let's spend some time going over FreeStyle Libre 2 and the updated real-time glucose readings. As a review, the FreeStyle Libre 2 sensor is applied to the back of the patient's arm. It involves a sensor being inserted into the arm to measure the glucose values in the interstitial fluid. And a reader or a smartphone is then used to obtain the glucose readings. So again, the sensor is reading the glucose values in the interstitial fluid and not the capillary blood glucose compartment, which is what is being read when you use finger pricks. On this slide, we've just summarize some of the steps for application. We won't go into it in depth, but in general, you want to make sure that the patient's arm is clean and dry. You want to make sure you load the device up properly following these instructions, and you'll get these slides at the end of the presentation. And then you want to firmly apply the sensor on the arm. Sometimes patients may experience some issues with the application, and common tips include rotating sites when replacing the sensor, making sure the skin is clean and dry, and avoiding lotions for best adhesion. And also, if patients are having a lot of issues with the sensor sticking, they can add on an adhesive or an overpatch to help the sensor stay on. Another tip that we have is when loading the the application device, the applicator. Use a hard surface when pushing it down to ensure the sensor is properly loaded. Otherwise, it could potentially fall out before you're able to apply the sensor on. Other points for troubleshooting. So if patients have sensitive skin, you can use an adhesive barrier wipe. And we already talked about tape in the previous slide. If patients are more likely to sweat or having issues with adhesion. And as a note, the patient can call Abbott customer service for any issues with the sensor. And generally, if the sensor malfunctions, customer service will be able to support them potentially with a replacement. Okay, we have another poll question, this time about lag time. So let me start that poll. Okay, so we just mentioned this earlier. It takes time for glucose to make its way from the capillary. So that's where you do a finger prick into the interstitial fluid. So when patients scan their CGM, there may be a lag. With some of the newer glucose monitoring sensors, the lag is I'll give you a couple of seconds. Is it less than 3 minutes? Is it 3 to 5 minutes? 6 to 10 minutes? Or 11 to 15 minutes? Okay, let's end it there. So most of you got it right. It is less than 3 minutes. Let me close this and then we can talk about it. Excuse me. So on this diagram, you might have seen this diagram before when we did our previous presentation, and it just shows the differences in blood glucose values, when you measure the interstitial fluid versus the blood. So because the glucose first gets into the blood, after you ingest it, it goes into the blood before getting into the interstitial fluid, there's always going to be a lag, and that lag time is about 2 minutes. So those who chose under 3 minutes, you were correct. It is 2 minutes. We did a survey earlier this year within the banner, and one of the common questions was around that difference between sensors versus finger pricks. So as mentioned, we're testing glucose values in 2 different compartments with 2 different values for glucose. So it's common for it not to line up. Another question that we often get as well is on accuracy. And on the left-hand side of this slide, I've put in the error grid for FreeStyle Libre 2, which compares the sensor readings on the y-axis with true venous blood glucose values on the x-axis. So you can see it's almost, it's a cylindrical shape, but kind of cone-shaped. And as we get closer to lower blood glucose values, like less than 3.9, accuracy is quite high, with over 98% of these values being within 1.1 mole of the true value. Millimole of the true value. So back to the question on why the sensor and finger prick reading is different. Again, it's common for finger prick and sensor readings to vary. They each have their own margin of error, and neither is a true representative of the current venous blood glucose. So this chart on the right-hand side of the slide shows a representative of what the readings would be in various different methods. So we have the true venous blood glucose shown by the blue dots. We have continuous glucose monitoring using the red line. And we have capillary blood glucose or finger pricks with black stars. So as you can see, sometimes finger pricks are a better representative of the true blood glucose, and other times the red line or CGM is. At the end of the day, the takeaway is that there's a place for all of these blood glucose monitoring systems, and they've been all tested for accuracy. So let's go into some of the new features. In the previous update, in the previous year, FreeStyle Libre 2 was updated to expand the indication, to remove the need for confirmatory finger pricks and to add optional alarms. In this latest update recently, we've added the opportunity to get real-time glucose readings. And there's also been updates with the Libre LinkUp app and customized alarms there. And we'll go into the Libre LinkUp app, which is for caregivers to use in the following slides. So as a main highlight, the main update is the real-time glucose readings. With the updated app, patients now get these readings. There's no changes to the sensor. It is still the same sensor. It's an app update that patients have. The readings are automatically updated every minute. So the sensor takes the reading every minute and sent directly to the patient's smartphone. As mentioned, there's a lag time of about 2 minutes compared to blood glucose readings. And in case the sensor disconnects or they're not able to get real time, if the app isn't compatible, if their phone isn't compatible with the app update, they could still use the scanning function to be able to use FreeStyle Libre 2 as before. So one of the key questions, and I know we've addressed this in previous slide, but again, why real-time CGM versus intermittently scan CGM? So in the past, when we do intermittently scan, where the patient is scanning it, you have situations where you see the target range, right? And you see, okay, this patient's target range is 78%, so that's good. But then when you take a look at it further in terms of how much time the sensor is active, you see that the sensor may only have been active for 34%. So that means that this patient only scanned once per day. So it only captured about 8 hours of data per day. So it's still not the full picture. With real-time CGM, we can make sure that we're getting that full, those full readings throughout so that we could have a better picture and estimation of the time and range of their A1C and their glucose variability. Okay, so with all of these updates, again, which patients should use FreeStyle Libre 2 or continuous glucose monitoring? It's recommended for patients over 4 years old with diabetes with any of the following. So if they need to test multiple times per day, if they're using insulin multiple times per day, if they're experiencing hypoglycemia, so their diabetes isn't well controlled, if their A1C targets are not being reached, they can really benefit from the insights that continuous glucose monitoring and that real-time data can offer. Now, that being said, anyone with diabetes or individuals with prediabetes as well can also benefit from these insights. And, coverage is one thing. Costs, I know, is always a consideration, is always an issue that we deal with. And we'll talk about coverage later on. But in terms of who would benefit, these are the patients where it's really recommended for. But again, anybody with diabetes can benefit from having the real-time insights. Okay, so let's go into the apps and software. So what's available within the FreeStyle Libre 2 ecosystem? There are 3 platforms. There is the FreeStyle Libre 2 app, which is what is used to collect the data from the sensor. There's also a LibreView app, LibreView web platform that healthcare providers can use to get real-time data from these readings. And there's also Libre LinkUp, which can be used by caregivers. So again, there's 3. There's the FreeStyle Libre 2 app. So this is the only app that patients need to worry about. There's the Libre LinkUp app, and this is for patients and caregivers. And there's LibreView, and this is for healthcare professionals. So including pharmacists, you can set up a LibreView account to get data from your patients. And we'll go into that in just the next few slides. So with the FreeStyle Libre 2 app, this is the home page of it. And you can see there's a lot of data on here already for patients every time they open the app. They have optional alarms, so they can set alarms based on their high and low values. They have, with the new update, the current real-time glucose readings and corresponding banner color. So this color is green now, but it can change to yellow or red based on the reading that the sensor is picking up real time. We have the trend arrow, which was there before, which indicates where patients' glucose is heading. And we have a slide on how to interpret that in one of the following slides. We have D here that shows an 8-hour glucose history. And patients can also add notes as well on this homepage. So if they experience hypoglycemia, or if they experience hyper, or they take insulin, or have a meal, they can add a note straight from this home screen. Another update as well is that in the alarms that patients can set up, these are optional alarms, they can show up on their phone screen, and now it doesn't just say low glucose, it also includes the value, and it includes the corresponding trend arrow. So we'll spend a few minutes on this app's view screen. And these are all the different types of reports that patients can open up just with a touch of their finger right on the patient app. And there's so much data that can both support patient self-management, but also the pharmacy team in supporting these patients. So the first thing after you go into the home page, you can open up the sensor usage report. And this sensor usage shows the amount of time that the sensor is active. Now, this is an older image, so it shows like percent of sensor data captured and scans per day. But since it's real time, the percent of sensor data captured will be a lot higher now, since it's always pulling that data versus before when you're scanning it and you may be missing data. What's important here is to make sure that no data is being missed. And you also want to check how many times that the patient is checking. So now with the real time, this value here will show how many times the patient actually opened the app and looked at their glucose value. So after taking a look at that, you'll go to the next page. So the time and target range. And again, we talked about for most patients, that's 3.9 to 10 millimoles per liter. And we want at least 70% within that range for most individuals. So you can quickly see sensor usage, you can see time and target range, and then based on the data we get from there, you can also open the estimated A1C value. So already you have so much information on how the patient is doing overall. After looking at these three values, our next priority is really identifying those hypoglycemia events to prevent hypoglycemia for the patient. So you can open up the low glucose events report, and it shows on average, within the time frame here, where at what time it was most common for the patient to experience low glucose events. And that way you can have a conversation with the patient. You're having a lot of hypoglycemia at this time. Is it correlated with your medication? Is it correlated with exercise, or are you fasting, or things like that, to help have that clinical conversation with the patient. After you look at low glucose events, you could take a look at the daily patterns report. And the daily patterns shows an overall trend of what's going, of your patient's glycemic variability within the past 7 to 14 days. And what you really want to see here with the daily pattern is you want to see a really narrow blue river, because the more wide it is, that shows a greater variability, which shows a lack of glucose control. So right from the patient's app, you can open all of these reports really quick with them when they're at the counter. Your technicians or your pharmacy students and assistants can help open up these as well while the patient is waiting to be counseled. So we put these slides in here to go over the arrows. So if we go back to the home page, you can see that on the home page for the FreeStyle Libre 2 app, it'll show the patient the reading, but also shows them the arrow. So what the arrow means is that the arrow shows what's going to happen in the next 15 minutes. So depending on the arrow, whether it's down and falling quickly, if it's going down and across, means it's falling. If it's going straight across, it's changing slowly. If it's rising, or if it's going straight up, it means it's rising really quickly. And we've included some guidance in here on what that means in terms of numbers within the next 15 minutes. So it's important when patients are taking a look at the homepage and taking a look at the different reports that they take, not only the value on the homepage into consideration, but take the arrow and take into consideration the context of when that reading is being looked at. So for example, if the patient on the homepage sees 5 millimole per liter, but it's falling fast, that means it's going to fall over 1.5 millimole in the next 15 minutes, then that patient may want to eat a snack and recheck in the next 15 minutes. If it's 4 millimoles per liter, but it shows that it's rising, that means that no action could potentially be needed and you want the patient to recheck again in 15 minutes. And again, if it's something like 6 millimole per liter, it's falling fast, you don't want to just take it in isolation. You want to consider if it's fasting or fed. Does it make sense? Did they just have a meal? Did they just exercise? When's their next meal? Consider the context and recheck in the next 15 minutes to see where those values might end up. Okay, so we went over the FreeStyle Libre 2 patient app. Let's go into quickly the Libre LinkUp app, which we didn't go over in the last session that we had. And the Libre LinkUp app really allows caregivers to access these real-time readings now, which are pushed from the patient's sensor and their app straight to the Libre LinkUp app if they're joined. So it allows patients to share their glucose readings with family members and caregivers. Up to 20 people can track trends from their smartphone. And now it accommodates the real-time readings and automatically receives readings every minute, similar to the patient's app. And this is an example of what it looks like. So this would be the view for the FreeStyle Libre 2 app user. So this is the patient view, and this is the caregiver view on their platform. And again, this is the patient view. So let's say they had hypoglycemia. This is what would show up, and their caregiver would see that alert with value and the arrow, and then they would be able to open it up and see more information also. So really great tool to support caregivers in taking care of children, taking care of older patients and individuals who might need a little bit more support. So the last platform that we'll go into is Libre View. Now, I just want to preface this by saying that this platform, it is for healthcare professionals, and pharmacists can benefit a lot, especially if your practice is focused on diabetes and you want to transform your diabetes clinics. You want to transform the way that you support diabetes patients. You may want to look into this app. It's not for everyone. There's a lot of data that you can get from it. Ultimately, it is easy to set up and you can try it out. And if you do need help setting up, Abbott representatives can be contacted to set it up. I've set it up for a couple of our pharmacies and it's not that hard. And I'll just go into what it looks like. So once you have it set up, you actually have a dashboard where you can have all of your patients in a roster similarly. And you can see a really great snapshot of the patient's glucose values. So you see the patient name, you see their average glucose, you see the number of scans and views per day, you see their percent in target. So is it at that 70%? So you can see a very quick snapshot on here. And then once you click into this report, you can generate a personalized AGP report for your patient, which provides a great summary of all of these readings. So we'll go into each of these sections in the next little bit. Outside of AGP report on Libre View, there's also more detailed reports of logged meals, insulin, other daily patterns you could look at if desired. And at the end of the session, if anybody's interested, we could take a look at the report I pulled for my glucose readings. And as a note, again, Libre View, this is not required for all pharmacists, but again, if you're focused on diabetes, this could be something to really benefit your practice and your patients. So let's look deeper at the AGP report. At the very top of the report, we have the glucose statistics and targets and the time and range. So on this half of this page, what you're interested in and it is again that percent time sensor active. So how active was it? Obviously, it's very high because now it's real time. So you're going to see a high value. You're going to look at the average glucose. So for this patient, it was 9.6 millimole per liter. So that's their average glucose. The GMI is the estimated A1C. So their estimated A1C is actually 7.6 for this patient. And their glucose variability is 49.5%. And glucose variability means how far the patient's readings are from their average glucose. So again, how wide is that blue river? If it's narrow, that means there's low variability. If it's wide, then there's a lot of variability. And patients, we want to target less variability. Our target is less than 36%, which is seen here. On the right-hand side, we want to look at the time in range. So for this patient, their time in range between 3.9 and 10 millimole per liter was 47%. So obviously, again, if we recall what the target is, we want at least 70% between 3.9 to 10, which is the target for adults. What's troubling here as well for the patient is we see that there's 10% within low and very low. So we definitely want to act on this hypoglycemia that we're seeing. And you can see it gives you a guide here. So below 3.9 millimole per liter, we really want less than 5%. So less than 4% below 3.9 millimole per liter and less than 1% below 3 millimole per liter. So this patient is experiencing hypoglycemia. So the next data that you see on the AGP report, so we went over the top half, and then there's the bottom half. We have the ambulatory glucose profile, which again is talking about that glucose variability. And again, we want that a more narrow river, which shows a tighter glucose control, less variability. When you look at this as well, you look at how thick the river is, but then you also check how many points is it going past the target range. So for this patient, we see here that they're experiencing hypoglycemia around 2 a.m. generally, around 6 a.m. And then they're experiencing some hyperglycemia in the afternoon and evening also. And then you can take a look at the daily glucose profiles to see if there were any outliers. Was it due to Thanksgiving dinner or was it due to a celebration, right? And then you can have, this really informs your conversations with patients to be able to provide more meaningful data compared to what we used to have in the past with just a fasting blood glucose value. And again, I'm not going to go over all of these again, but I wanted to put this slide in here again to say LibreView is a great tool. It provides a lot of these readings, but if it's not feasible within your practice, you can still glean a lot of that valuable information from the patient app view using all of these reports, which are very easily accessible. As a summary for reviewing these reports with your patients, number one, you want to check the amount of time the sensor is active and the number of views per day to make sure they're actually looking at their readings. I actually found that sometimes because like the Libre was so unobtrusive for me, and obviously because I don't have diabetes, I would forget to check, right? So on the app also, patients can set reminders so that they can be reminded to view the app and check their values every X number of hours. After checking that, you'll look at the time in range. And again, we're targeting at least 70%. You'll look for low glucose events, and that hypoglycemia is really important for us to manage with patients. And then you'll also check daily patterns and variability. And especially around variability, it could be around consulting them more about nutrition or their physical activity, and considering pharmacological treatment adjustments. I know a lot of our patients may not be exactly on the most first-line therapies as recommended by Diabetes Canada, so it could be a good opportunity to have those conversations. Okay, we're nearing the end of our slides here, but we wanted to go over some workflow considerations. So for the pharmacy workflow, there's a couple of steps when you're getting patients started. So number one is identifying patients who would benefit from CGM. And again, we had that slide previously where we talked about specific patients who are testing frequently, who are not meeting their targets, not meeting their A1C, who would benefit. But it could be prediabetes and diabetes, general diabetes patients, even taking oral therapy, who could benefit from just seeing the insights of their day-to-day trends as well. Then we take a look. After you identify the patient, you review their diabetes management. You could recommend CGM to them if desired, if it's relevant for that patient. Once you recommend it, you could start the patient on a trial of the system. If they need a prescription for coverage, you can send the request to the prescriber. Once when the patient starts and you have that initial consultation, help them apply the sensor. You can counsel on the use, make sure that you talk about the readings, what the arrows mean, which we went over, how they can use the alarms. At 2-week follow-up, so since the sensor lasts for 14 days, as Libre 2 always has, you want to bring them back in to discuss their glucose trends and go over all those steps that we went over earlier with the patient app data or Libre View data if you have it set up. And following that, and if they continue on the system, schedule them for a follow-up to see if your recommendations after you've been implemented made a change to those readings. And, with diabetes, we know it's continuous follow-up. And hopefully you live in a province where you can utilize pharmacy services to be able to have these conversations with patients. So doing the medication reviews and follow-ups with them. For key patient counseling points, when getting started, we want to counsel on use of alarms, glucose readings, trend arrows, and encouraging regular checks and setting reminders where necessary. At follow-up, we want to check Libre 2 or their app or Libre View. We want to assess the percent of time sensor is active and the views per day. We want to assess time and range. We want to look at how glucose events and glucose we want to look at low glucose events and variability and identify patterns. And we want to review if there's any alarms that were set off, if there was a high or low, and how to manage that with patients. Okay, so that concludes the clinical part, but we have a couple of slides on coverage, and I'm going to actually pass it off to Sydney to talk about this next slide on provincial coverage.
Thanks, Molly. So as you can see here, multiple provinces and drug plans provide coverage for the FreeStyle Libre 2 system. However, coverage is only for patients who manage diabetes with insulin. Other criteria are also in place, such as age limits in Saskatchewan and Manitoba. And for more detailed information, you can go to the FreeStyle Libre website or go to the specific drug plan websites. And it's also important to note that most private insurance companies cover the FreeStyle Libre 2 system for patients managing diabetes with or without insulin. And then I'll pass it back to Molly.
Okay, thanks, Sydney. We have one slide here about the patient support cards. So for pharmacies in BC, Alberta, and Saskatchewan, earlier this year, you should have received a tear pad with this SDI card that helps to cover a portion of the cost of Libre 2. For those who have run out, feel free to contact your Abbott representative and they'll be able to send more if you need it. But it is unfortunately only available within these provinces. And that kind of concludes the end of the presentation. Happy to address any questions. As a quick summary before we end off, the main points of this presentation are the importance of CGM, right? Both flash and real time. And I just want to make a note here that for individuals who are using the reader still, so not using the app with Libre 2, the reader is still doing flash. So you can't do real time if the patient is on the reader. So in some situations, Libre 2 can still be used for intermittently scanned or flash glucose monitoring. But continuous glucose monitoring in general can help reduce glycemic variability. It improves A1C, it increases time and range, it improves patient outcomes and reduces complications. There's a lot of apps, as a second point, there's a lot of apps and platforms out there to help both patients, caregivers, and healthcare professionals better self-manage and empower patients to understand their diabetes and take control of their management. And as a last point, pharmacy team members, including pharmacists and other team members, can identify patients that might benefit from continuous glucose monitoring and train them, help them understand, the apps and the reports that they can use, help to pull that up at whenever they're visiting at the counter to improve their self-management.
So Molly, there are a couple questions or comments.
Yeah.
And I think you kind of addressed the first one already. So the first one was, is the upgrade to real-time only available to those users who use the app or smartphone or is the Libre 2 reader able to facilitate this improvement as well?
Yeah, so unfortunately right now, the real-time feature is only available on the app because it was an app update. The sensor itself is still the same between those using the reader and the app. So if the patients are still using the reader, it's still scanned and still, so the message to them would be to remind them to scan at least every 8 hours so you can get the full data.
And I put the link in the chat for evaluation. If anyone has additional questions, feel free to put them in the Q&A and we'll get to them. So the next one is from our friend Siva, and it says, "Hi Molly, thank you so much for everything so far. I use the patient view a lot, and I found that the low glucose events are really important. Sometimes I see 0% below in time and range, despite them reporting 2 to 3 low glucose events. So what you said is really helpful, and it makes sense to not forget to look at low glucose events. Thank you." Molly, you're on mute.
Okay. Thanks so much, Siva. Appreciate your comment. I'm glad that you're using the patient view. And it sounds like all of those, let's go back on the presentation. Like there's such value that you can quickly get just from looking at these reports on the patient app view, right? So with quick interventions and easy interventions at the pharmacy counter, there's so much that we can educate the patient on, and we can empower them to look at this in the future. So for sure, looking at the time and range, but also, one of the main things we want to focus on with diabetes is reducing their hypos, right? So making sure to double check those low glucose events.
So Molly, I was going to give you a question. You kind of hinted at it, but if I was going to look at these reports in a particular order, triaging a patient, which ones should I look at and in what order?
Yeah, so we tried to order them in like a consecutive way, but definitely you want to look at the sensor usage, and you can pull all of these like on the app, on the patient app. There's a menu. You can pull all of these really quickly, ask them to open up the sensor usage. You can see their the sensor activity. You can see the amount of times they're checking per day. Look at the time in target range. And of course, you want to see this green bar at 70%, and you don't want to see any hypos, so any under 3.9. You want to look at the low glucose events. You can take a look at A1C too. Although again, we talked about how A1C is correlated with time and range. And because we have such rich data from Libre 2 and from these CGMs, oftentimes the time and range can be more useful than just looking at the isolated A1C value. But yeah, definitely want to look at low glucose events. You want to look at these kind of all give you similar information. The daily patterns I find is a really good one, just to see really high level how in control, like, is there a lot of variability? How wide is that, right? So you can see that very quickly. And with these average glucose measures, where it gives you the time in which, there are highs or the time in which they're in range, then that helps you with narrowing it down with the patient. When do you typically eat? When do you inject your insulin? How many units, right? And that provides more context on why these trends are occurring.
So Molly, if there's a pharmacist listening that's, a little bit hesitant, hasn't really engaged in patients with these, incredible amount of information we can now get about their glucose profiles, what do you think would be their first step? How should they get in? Like, what's the easy in for them to get engaged in this space when they're a little bit, maybe nervous to dabble with the tech?
Yeah, that's a really good question. And honestly, what really helped me out is trying the system for myself, right? So then I could see all of my values. I can see in real time how me having an ice cream instead of having no dessert impacts my glucose values, not just at that time, but, overnight as well. So I would say if you're not familiar with the system, the first step is obviously attending sessions like this really help. But getting your hands on a trial can be helpful, and you could reach out to your Abbott representative and they'd be able to help you with that trial. And then once you have a better understanding, then you can introduce it to patients. And I think it's really important to show to patients just how unobtrusive it can be and how easy it is to get all of this data that they didn't get before, to make better decisions, right, with their diabetes management.
So if I was that pharmacist, Molly, what I would suggest is, you know which of your patients are using the Libre 2. So I would pick a couple of your friendly patients and say, hey, I want to learn how to use this better to support all my patients. Would you mind letting me see your app? Can you tell me how you use it and what information you're finding useful? And then have a conversation with them about that privately. Maybe they would share their data to you as well, so you can kind of work through it. And I find, at least I found, a lot of my patients thought they were doing better than they were. So I think there's often opportunities to help them understand their data even more so they can make better decisions in their self-management.
Yeah, that's a great point. Um,
Oh, but there's another question. Ask the Avid rep for samples. So that's Siva.
yeah, it's a great
All
point.
the students I precept trial it for 14 days, and it really helps them understand how to better help patients. That's great advice.
Um, so thank you so much, everyone. If you could fill in our survey, that really helps us with getting a better understanding of how to present our sessions in the future. If anyone's still interested, I'll pull up my full Libre View report just so you can see. And I don't have the full 14 days data on here, but you can see what's included beyond the AGP reports. So let me just.
Yeah. Molly, you made great timing on the slides. Like, we flew through those.
Yeah, I was worried about the timing.
If anybody needs a copy for reference, for sure, let Molly know, because we went through them quite quickly. This recording will be available on our Facebook and on our YouTube, so feel free to check out the recordings afterwards as well, because they're incredibly detailed, but quickly we move through them. So we'll make sure they're available for you.
For sure. And so if you can see the screen here, I have my full AGP report. It's 14 pages, so that what I went over in the presentation just now is just the main AGP report with the summary. And again, a lot of these things, as we went over, you could find on the patient app as well. But if you keep going there, it breaks it down further within time and range. You can see it highlights where these lows are happening. And obviously for me, as someone without diabetes, there was a lot of overnight lows because the system isn't calibrated for someone without diabetes. So that's just important to remember if you do try the system. And you can see there's other helpful reports like the monthly summary, where you can see each day, like what is the average glucose, how many times did they look at the sensor, and how many times was there hypoglycemia. And just a lot of value here. I didn't log any of my meals, or obviously I didn't log insulin, but it would show up on here as well for patients who do log it. And this is very easily generated right off of that dashboard that I showed you. And there's so much context that it provides you if your focus is really on diabetes. And in the age of more virtual care too, it gives you the ability to provide such rich recommendations to patients, even when they're virtual.
Yeah, it's really incredible, Molly. I can remember starting out my career just 13 years ago and, begging my patients to log for me or bring in their meters, and I would flip through the readings. So much more information now. It's incredible. And there's a question here, Molly. So with the Libre View, a healthcare provider can see multiple patients' glucose trends.
Yes, so you can pull this entire document for all of your patients that are affiliated with your Libre View clinic. And you can see they'll show up, everyone on the dashboard. You'll see their names, you'll see their average glucose and their target range, so you can quickly identify who might need to be prioritized.
That's incredible. And there's another question about, can we get CE points for this presentation? So
we get that question sometimes, but we don't typically do CE points, but thank you so much for your attendance anyway. If that is very important to you, let me know and we can explore it for the future.
So Molly, it depends on your province as well. So if you're practicing in Ontario, you can record non-accredited learning into your learning portfolios. That's fine, but some provinces require accreditation, which most of our lessons are not.
Yeah, good point. So we went over all of these very, very useful reports, and you can see it day by day too. The average glucose, total carbs, total insulin, if I was logging that, the hypoglycemia. But again, I don't want to scare anybody off with LibreView with the amount of data that you get. Not saying you have to sign up for LibreView. It can be really helpful if you're willing to put in the time and to train the patients and to look through it and to do the reviews, utilizing your pharmacy services. But again, a lot of this important data on the AGP report, again, is on the patient app.
Okay, Molly, I'm gonna call the end of the session. Thank you so much, Molly. That was really incredible. You took us through a lot of information in that update, and Sydney, thank you as well for your contributions tonight. I think it really helped all of the folks who are listening in understand these important updates about the Libre 2. So thank you, Molly and Sydney.
Okay, thanks so much, everyone. Have a great evening.